How's she been the past week?
She's been really very active and happy.
Good.
Dr. Narda Robinson is dedicated to improving animals' lives. As director of the Comparative and Integrative Pain Medicine Center at Colorado State University, Robinson uses the practice of acupuncture to bring relief to her patients.
Any type of pain problem can be approached with acupuncture. Acupuncture works by stimulating nerve pathways, so if we can rev those nerves up and get those signals going back to the brain, then they get up and running that much sooner.
Good job. Currently an instructor at CSU, Robinson says her students are not studying acupuncture as a metaphysical approach to healing, but as an anatomical medicine.
The most unique aspect about acupuncture here at Colorado State University is the strong scientific basis. We're really bringing it back to its ancient roots of being just real medicine, as far as we're working with tissues, we're working with the vessels and the nerves, and not looking for something metaphysical to happen.
Real medicine requires real knowledge.
Acupuncture relates to nerve stimulation. And in order to find those nerves, you need a good background in anatomy, the musculoskeletal system. You need to know where those nerves travel along the body. And then how the nerves within the anatomy are going to function because of the structure-function relationship between the neuroanatomy and the neurophysiology. And it's really the physiologic changes that arise from stimulating various nerves that determines what the outcome from the acupuncture treatment will be.
In order to properly stimulate nerves, students need a way to practice finding exact point locations, but the process of learning the nerve locations can be a strain on the animals.
2, 3, or 4 hours at a time, we give the dogs breaks, but still they get nervous, there are a lot of people around, and I'd like to reduce that stress even further, and that's why I thought, is there some other means by which we can produce a realistic, anatomically accurate specimen that students and veterinarians can learn the point locations on and refine their needling skills well before they ever touch a live animal in this kind of realm of learning acupuncture.
Dr. Robinson approached Peter Young, associate professor in CSU's Department of Electrical and Computer Engineering, with her idea. With the help of undergraduate engineering students, SimPooch, a simulated dog with virtual reality interface, was born.
We were put in touch with Dr. Young because I learned about the haptics interface that is the key for this project, which provides the realistic force feedback that can simulate to the best degree possible what it would be like to insert a needle into tissue.
Haptics is the study of touching behavior. The haptic device, in this case a pen, provides pressure feedback. When programmed correctly, it becomes a virtual reality simulator.
If I feel this model dog skull with this pen here, the reason I feel a hard geometry here is that when I move my hand to this point, it stops, right? So now I can imagine if this wasn't there, and a robot arm had a hold of the back of this pen, and it pulled me up short whenever I reached that geometry, then as far as I'm concerned, I would feel like the object was actually there. And that's the idea of haptics. So I have a robotic system that's providing the force feedback, and with the appropriate programming, which amounts to a feedback control system, I can take measurements from the haptic device, which basically gives me my position in 3D space. It can say you're at this position, so you should be feeling this force, and I output that force through the robotic system. So basically that allows me to create virtual objects that I can feel and interact with even though they're not actually there. From an engineering viewpoint, the idea of working in this sort of multi-sensory computing environment where you can, both see and feel the objects that you're interacting with is very exciting. What you've got now is a haptic device that essentially can display forces. In much the same way that this monitor displays images, we can now display, forces or the feeling of an object.
Brendan Dahl is one of the CSU engineering students hard at work making SimPooch a reliable training device.
I can actually feel the dog head there. So the mouse is actually pushing back on me, so it feels like there's some surface right here, like a wall right here. So as I push, and the nice thing about these surfaces too is you can do sort of a spongy surface or just however you want to do it. So you can make a surface that's soft on the outside, then once you go a little deeper it would be harder. So that would simulate like the layer of flesh, and then maybe you hit a bone or something, so it'd be really hard. you wouldn't be able to get past that point.
When the project is perfected, the efforts of Colorado State's SimPooch team will forever change the way acupuncture is studied.
On our simulator, you can, initially take your time, build your skills up till you get to the point where you can, do it quickly. The other thing is that we can measure exactly where you hit. So in other words, both in terms of practice for you, but also in terms of assessment for the instructor, they're going to get a very precise measure of exactly how well you did. What we're trying to do here is bring together the power of computation and virtual simulation and use those to develop an acupuncture trainer. And in so doing, hopefully provide the students with a next generation training tool that's going to give them a much better experience than anything they've had before.
And even more important than improving the learning experience for students, SimPooch will greatly benefit our animal friends.
I'm excited about this project because it can relieve animal suffering in so many ways, not only in teaching but also in practice, where we'll have people that have really refined their skills in the learning phase and have done so without needing to engage animals over and over again for traumatic or painful techniques. And once I felt the realism of that, I was sold.